Welcome to the SABC News COVID-19 Global Wrap, where myself, Babalole Phaka, and my colleague Busisiwe Khatebe bring you highlights of news which dominated headlines with regards to the coronavirus pandemic. But before we delve into it, let us have a look at some global stats. The world currently has over 134 million infections, with over 108 million recoveries and over 2,915,000 deaths. South Africa has 1,554,975 cases, with 1,480,632 recoveries and 53,173 deaths.
Staying in South Africa, Health Minister Dr. Zweli Mkhize says government has secured 51 million vaccine doses from pharmaceutical giants Pfizer, Johnson & Johnson, and the Covert facility. The Johnson & Johnson doses will arrive on Monday, while a schedule from Pfizer, which will shed light on when the company's vaccine will arrive in South Africa, is expected sometime next week. And lastly, the new development bank of the BRICS group of nations has approved a second COVID-19 loan to South Africa as the fight against the pandemic continues. The loan is worth over 14 billion rand. On to the rest of Africa. The continent has now recorded over 4.3 million COVID-19 cases with more than 3.8 million recoveries, and the death toll stands at 115,228. The African Union dropped plans to buy vaccines from the Serum Institute of India and is exploring options with Johnson & Johnson. On Wednesday, European and British medicine regulators said they had found possible links between the vaccine and extremely rare cases of brain blood clots, while emphatically reaffirming its importance in mass vaccination against COVID-19. John Kengasong, head of the Africa Centers for Disease Control and Prevention, says the AU's decision had nothing to do with those findings and reiterated his advice that the benefits of the vaccine outweighed the risks. Tunisia approved Johnson & Johnson's vaccine, Health Minister Fawzi Mehdi said, and will soon receive 1.5 million doses of the vaccine under an African Union plan. And lastly, Algeria will start producing Russia's Sputnik V vaccine in September in partnership with Moscow, and part of the production will be intended for African countries.
And in international news, in the United States, President Joe Biden says government will move up the target to make COVID-19 vaccines available to everyone 16 years and older by nearly 2 weeks. Biden will direct states to widen the vaccine eligibility by April 19, 2 weeks earlier than the May 1 deadline he announced previously. No COVID-19 vaccine is yet authorized for children under 16, although testing is underway. Meanwhile, more than 165 million Americans have received at least one dose of the coronavirus vaccine as the country ramps up its daily doses to close on 3 million shots per day. While officials are lauding the fact that the country is outpacing much of the world in immunizing its population, they continue to raise alarm at rising case numbers. They're also still concerned that an average of slightly below 900 deaths per day were recorded over a 7-day period. In South America, Brazil has recorded its first confirmed case of the highly contagious COVID-19 501v2 variant, first identified in South Africa. The Federal University of Minas Gerais says 2 samples taken in the country's inland city of Belo Horizonte included a previously unseen set of 18 mutations, including some in the genes modified by the 501v2 variant and Brazil's already prevalent variant known as P1. The detection of additional variants adds to concerns that a brutal COVID-19 wave battering Brazil may keep breaking grim records of daily infections and fatalities for weeks to come. In Asia, South Korea on Wednesday recorded its highest daily figure since early January, reporting 700 new infections. The rising cases fuel fears that the country may be facing a 4th wave of infections, while Prime Minister Cheng Sai-king reiterates warnings that new social distancing rules would likely be needed. Meanwhile, India reported a record 126,789 new COVID-19 cases on Thursday. This comes as several states struggled to contain a second surge in infections, complaining of vaccine shortages and demanding inoculations be expanded to younger people. The spike has caught authorities by surprise, with government blaming the resurgence mainly on crowding and a reluctance to wear masks as shops and offices have reopened. In Europe, France's hospital system is under heavy pressure from the pandemic, with the number of people treated in intensive care units for COVID-19 at the highest in almost a year. France is hoping a ramp-up of its vaccination campaign, combined with the one-month lockdown in place since last weekend, will help it regain control over the latest outbreak fueled by variants of the novel coronavirus. In Britain, Prime Minister Boris Johnson said on Monday everyone in England will be able to take a COVID-19 test twice a week in a new drive to track the pandemic as society reopens. Johnson said the new mass testing program would break the chain of transmissions and spot cases without symptoms. And finally, the World Health Organization expects there will be no reason to change its assessment that the benefits of the AstraZeneca vaccine against COVID-19 outweigh any risks. The WHO says it is closely studying the latest data alongside European and other regulators in light of reports of blood clots among people who have been vaccinated.
For the latest updates on the coronavirus, visit sabcnews.com.